Dr. Beck, I would like you to explain, surgery versus non-surgery when it comes to heel spur and plantar fasciitis, or whichever way you pronounce that. Anyway, your foot is hurting when you get up in the morning and when you have rested for a while, and it seems to be quite a common, common problem. Tell us about the treatments available there, the non-surgical one, and what's the advantage of it is.
Well, plantar fasciitis, like you said, is really common, and I've had severe cases myself, actually so bad I had to sleep with my feet in a trash can, because I couldn't stand any kind of pressure on my heels. And what this is basically heel pain, and it's caused by an inflammation in the tissue that hooks into the heel bone, and this is where people call heel spurs, as you've probably heard in the past. And what happens is people particularly note problems when they get up in the morning. Their feet, they tell me that it feels like they're walking on rocks. A lot of times they get tremendous burning pain in their heels, and it can just really kill them by the end of the day when they've been on their feet all day. So it can be very disabling and very discomfortable and very bad thing to have. And we treat a lot of this in our practice, and there's a variety of ways you can go about it. Now, we made a point earlier that the key to treating a condition is knowing which condition you're treating. Now, foot pain itself can have lots of different causes. One is from nerve damage, like you get in diabetes. It can be a pinched nerve in your ankle. There's a variety of different reasons why you can have heel pain. So key number one is to figure out exactly why you have the heel pain. Now, if you do have pain from a plantar fasciitis or a tendonitis in your heel, then there's some things we can do for it. The most effective treatment I have is a steroid injection into the heel itself. In many cases, people who've had problems for months to even years, we do one single injection and they're good to go. They don't come back, they don't have any more problems. Or they may just need a little tune-up injection in 6 months to a year. So very simple. It takes me 10 minutes to do the injection at most, and people walk out and they're doing great. So that's number one. Now, the second problem is to treat the cause of the tendonitis. And this is where therapeutic exercise becomes very important. And this is the reason I talk a lot about therapeutic exercise, because by using the right exercises, that being stretching and strengthening exercises, you treat the underlying cause of your problem. If you don't treat the underlying cause of your problem, you're going to keep having the problem. I think that, makes sense. And so this is where we get into what is causing the heel tightness, the heel pain, and frequently it's things such as tight heel cords, that big thick tendon at the back of your leg. If it's too tight, it puts pressure on your heel. If the tissue in the foot is too tight, that can put pressure on the heel. A lot of these things, weak muscles can cause you to walk funny and cause excessive pressure on the heel. All these things can cause heel pain or tendonitis in the heel, but they can be treated with what I call therapeutic exercise, that being stretching and strengthening exercises. So that's a very simple thing to do. It treats the underlying problem, and once you treat the underlying problem, hopefully you're not going to have the problem again. Now, in addition to injections and exercise, we can treat with things like anti-inflammatory medications. I don't like to treat people for a long period of time with these medications because they can potentially cause problems. A lot of people can get kidney and stomach problems from these medications. They're very upsetting to your stomach, so you don't really want to take them for a long period of time. And this is the reason why we want to treat the underlying cause, and that is therapeutic exercise to treat the imbalances in strength and flexibility that's causing you to have the problems.
All right. Well, wonderful. So there are, as we well know, surgeries available. Podiatrists provide them and things like that. Shed some light on that and give us the difference about this thing and the value. I'm sure there's a need for both of them in some cases.
There is. And, again, this is where we look at the majority of problems such as this, tendonitis problems, muscle injuries, muscle pain, don't initially require surgery. In other words, there's a lot of things you can try to do first before you consider surgery. And again, things like injections, exercises, medications, and even just simple insertions or inserts to go into your shoe may make the need for surgery obsolete. Now, if all these things don't help, then we can get you over to see the surgeon and see if there's something there he or she feels they can do for you to help your situation.
would that surgeon be a podiatrist or some other type of surgeon, or either one of them?
We usually start with a podiatrist, and sometimes orthopedic foot surgeons will also address the problem as well.
Mm-hmm. Okay. All right. Well, wonderful. And again, is there some testing involved for you to find out what, or is it just the guy comes in with a pain, it's very obvious, and you go and give him the steroid injection and whatever you then decide, or is there some major testing or some testing before involved?
It depends. If you're a real healthy young person and you have heel pain and it's fairly obvious what's causing the problem on physical examination, then we may simply go and do the injection and treat the problem. Now, I frequently see people that are older, they have multiple medical problems, particularly diabetes, where I can't tell if the problem is tendonitis or a nerve injury or a nerve problem. And in those cases, I have to go on and do more testing before I can really determine what it is the problem is. Because if I don't know what the problem, I can't treat it. And so it's sort of like, spitting in the wind. You're throwing treatments at a patient, but you really don't know what you're treating. So you really want to nail down the diagnosis and make sure you know what you're doing before you do it.
Right. Well, it seems to be, again, boiling down here that, a good testing, and me coming from a mechanical field, a mechanical machinery engineer field very originally, and again, if you didn't have a good testing, if you didn't know which cogwheel was the one which was not grinding right, I mean, you could work weeks on that machine, lay it apart, put it together, and still not find it. And that testing isn't always that easy. And obviously, with the nerve testing, you really have a good one, because otherwise you just, as you said, throw treatments at it, or as the expression back from that when I was in that field, if there's a problem and you give it to a carpenter, he will use a nail and a hammer. If you give it to a mechanical guy, he will probably use some welding rod and weld it together. So it's like everybody's going to use his tools. So really what you need to go to an agent who has all tools available. He himself might not know all tools. That's not expected. But he has all tools available to him, and then says, look, what we need here is a little bit of hammering, a little bit of welding, and a little bit of sweet, and we're fine.
Yeah.
I love it. Thanks a lot, Dr. Beck. Bye-bye.
Thank you.